Good afternoon. Welcome to the second annual Stroke Symposium hosted by the Brain Injury Association of America. We would like to start off first by thanking Ibsen for helping support today's symposium and making it possible. Please note today the symposium is 4 hours long. So it is a long afternoon, and we do have short, around 5 minute breaks between the sessions. So we are recording it. So don't worry that, like, if you need to step out, if you need to take a break, you will have access to the recording afterward. All attendees today are muted. So if you have a question, we'd like to ask you to please submit it using the Q&A feature in Zoom. And at the appropriate time, if time allows, we will read your question out to our presenters. So that being said, I would love to just jump right into it and start by introducing our first presenter. Um, our first session examines life after stroke, kind of work, relationships, community, everything that involves. And we'll hear from two stroke survivors today who will share their personal journeys and insights and experiences. And I'm so pleased to introduce our first speaker, Lee Glenn, who's a small business owner in Maine. And I'm so delighted that he's here with us today. Welcome, Lee.
Thank you, Stephanie. And good morning and good afternoon, I guess, depending on where you are. My name is Lee Glenn. I am a survivor. Um, just as a very quick aside, my conversation will touch very, very briefly on sex and suicide, um, just as a heads up warning. Um, I guess the best way to frame my conversation would be two very quick snapshots of uh, of where I was. Um, it was World Stroke Awareness Day 2017, October 29th of 2017, that I had my stroke. Sort of kind of funny that it happened on that day. Um, we uh, we had overnight guests, and my wife and well, my fiance at the time and I were up early, talking and snuggling under the covers and giggling, and one thing led to another. We made love, and I jumped up and headed for the shower. It was as I turned the light on in the bathroom, I realized that something was different. My hand felt different to me. And I looked at myself in the mirror and realized that the side of my face was going numb. I turned and went back into the bedroom and said to Sesha, something's wrong. I'm starting to go numb on one side. My doctor said that it was probably a spike in my blood pressure caused by activity that made a little blood vessel in my brain start to leak. Um, I was taken to the hospital and then taken down to a larger facility about 90 minutes away. All told, I was hospitalized for about a month. Um, I didn't remember much of it beyond when I got transferred into an acute rehab and uh, and started the process of recovery and rehabilitation. Um, I returned home to my farm after that morning, a different man. I wasn't the same fellow that had the stroke that morning. Everything was different. I was confined to a wheelchair, um, terribly depressed, and I really just didn't see how life could go beyond. I Eventually, I had home health come in and do rehabilitation with me. And eventually, I moved to a rehab facility connected with the local hospital. Um, Probably 4 months in, I had recovered enough that I was out of the wheelchair. I had moved from a wheelchair to a walker, and then had moved from the walker to one of those quad canes with four little legs on it. And uh, my routine was my father-in-law dropped me off at the rehab. I'd have a couple of rehabs, either voc and occupational or and speech, all mixed in. And then I would leave there and go across the street to the hospital. Let me give you a little tip right now. If you're ever in a strange town and you're looking for a bathroom or a meal, uh, simply follow those blue H signs to the local hospital. There's always a clean bathroom, and if they have a cafeteria for employees, some of the best food at the best prices. I was aware of that, and so I would go over and have lunch at the hospital in the cafeteria. As I was walking to the cafeteria, I noticed my reflection in the window, in the glass of the windows, and it was terrible. It was a reflection of a little old man on a cane and barely walking. It was just such a stark reminder of where I was that it affected me beyond measure. I got my meal and sat down at a table, but I couldn't shake that picture, and I started to cry. I got up and I left, and a gentleman followed me out the door, shouting to me, "Sir, sir." And I know he just wanted to help, but there were no words that someone could say to me that were going to break the mindset of where I was. I was deep, deep in the depression. On the way home, I walked with my cane to back to my house each day. Um, it took me about 2 hours to do the 3/4 of a mile with various stops along the way for rest. And I had to cross the Margaret Chase Smith Bridge, and I often thought about tossing myself over the railing. Just, I couldn't see how my life could possibly continue from where I was. I couldn't see it. Um, that lunch was truly the lowest point of my recovery. I, I'll take you all the way to where I am today, which is 8 years later. And at one point this past spring, for no particular reason, I walked into my office and I stopped and I said, "I'm back." And I truly felt that. 8 years later, I suddenly was filled with a feeling of well being. And I said out loud to nobody other than myself, "I'm back." And I truly believe it. Now, obviously, I'm quite profoundly disabled physically from that stroke, but mentally, I had recovered. And I'll tell you how that process played out, how that happened, that I had that terrible depression and ended up 8 years later saying, "I'm back." I sought psychological help for the depression, which wasn't terribly effective. He was a nice man, but there was really no connection between us. He gave me a couple of tips on things that I might do to break that terrible mindset, uh, but there really wasn't the connection that I was looking for. I went looking for a support group um, in my town that I called the local hospital and asked about a stroke support group. And they said no, that they don't deal with strokes, they transfer them to other hospitals. Um, I called the big rehab center, the acute rehab center that I had spent some time at, and asked about a support group. And they said, yes, they had one. They gave me a telephone number for the support group, but there was never an answer at the telephone number. It just rang and rang and rang. I finally heard about a stroke support group about an hour north of where I live. And my wife put me in the car and drove me up there for a meeting. This is probably 4 months after my stroke. She helped me into the room. It was at a local bank, and we went in the conference room, and I turned another corner because in that room were 15 or 20 stroke survivors, people that I didn't have to explain anything to, people that understood exactly what I was going through. Excuse me. I came out of that meeting feeling like the weight had been lifted off. Uh, just something about being in the room with fellow survivors gave me some hope. I enjoyed that support group, that 1 hour meeting that I attended. The guest speaker that day was a lady from the Brain Injury Association of America Maine chapter by the name of Sarah Gaffney. And I explained to Sarah what brought me there was that I couldn't find a local support group. And Sarah said, why don't you start one? Well, it had never occurred to me that I could start my own support group. I did. The local library was happy to give me a room once a month. And there were a few people that were willing to come in and speak. My neurologist and primary care physician were more than happy to put posters on their wall. And the first meeting had 3 or 4 attendees. And the next one was a little bit better. I got a phone call from that hospital, the acute rehab hospital, and they said that they realized that their stroke support group was no longer meeting, and would I be interested in restarting it if they provided a room for us? I said absolutely, and I found myself with 2 support groups going, uh, and all of the attending uh, organizing and promoting and trying to keep everything running smoothly, I suddenly realized that I stopped being depressed, um, probably because I was too busy to be depressed. Uh, I found that for me, if I had something to look forward to, if I had something that I was planning, uh, I really wasn't focused on myself anymore. I was focused on the task at hand. Uh, that definitely was a turning point for me. Uh, the second turning point came a couple of months later when we were living at camp and my fiance had returned to work, leaving me at camp for the day alone. Uh, I decided that I wanted to go into town, so I walked up the camp road to the main road with my little quad cane and I stuck my thumb out. And the first car by stopped, picked me up, and took me to exactly where I was going. That was a terrible mistake because when my wife came home, she wanted to know how I did that, and I explained I just stuck my thumb out. I found myself in my primary care physician's office the next morning with my wife and the doctor explaining to me that I couldn't do that because of my physical disabilities, I could be very easily preyed upon or victimized. And I had sustained some damage to the executive functioning, and I was making bad decisions, and we left that meeting, and I went car shopping. I, I went out and I bought a used convertible later that day. And for the next few days, my wife took me to a parking lot in town uh, and let me drive my new car around and around and around in the parking lot. And when I finally became comfortable with that, she let me drive to camp and gradually taught me how to drive again. I didn't lose my license as a result of the stroke. Um, I didn't have any seizures or anything like that. And I became a driver again, no longer a hitchhiker. I, uh, I think that that was also a pivotal point because we may not realize what an important piece of the puzzle that driver's license is. But for me, it provided um, that sense of independence that I hadn't had since the stroke. Um, that freedom to come and go really lit a fuse for me. Um, so I found myself on what I call the copay merry-go-round. That that was uh, a pretty good deal for the hospital and the insurance company. Let me explain. When the insurance company got billed by the rehab for $81, they negotiated a lower fee, $61, and then I paid 40 and they paid 21 for each rehab visit. And with all three therapies, speech, occupational, and physical, going on at the same time, it ran into a pretty good chunk of change every month. Excuse me. And I was very fortunate in that when applied for disability, it was immediately approved. Of course, I still had to wait the 6 months before money actually flowed, but I had that disability payment that helped keep me afloat financially. Uh, but the copays, honestly, were a bit of a burden. I I had to struggle a little bit financially, and that is what caused me to launch my own business. Prior to the stroke, I had had an interest in antiques and going to auctions to purchase them and then selling them as a hobby on eBay. And so that model is what I fell back on when I needed to make a little bit of pin money. I drove myself to a local auction and spent less than $100 on a few small things that I could handle. I brought them home, spread out a white towel, and photographed them and listed them on eBay for sale. I didn't set the world on fire. I probably sold two or three things in the first few weeks. But what that did was it allowed me to continue my rehabilitation on my own. I was still going to rehab, but this, I guess I have to make a confession. I was not the best rehabilitation patient. Now, I did thoroughly throw myself into it, but I found the exercises that I was supposed to do in the off times terribly boring, just mundane to sit there and do the same repetitive task over and over and over. Um, Really just didn't light my fire. But selling something on eBay and then having to package it, wrap it in bubble wrap, put it in a box, seal the box, print out a shipping label, put it on the box, and then take the box to the post office, bring it inside, and send it off. I found was just as productive, perhaps more so, than the exercises that I had been trying to do. Uh, I really and truly think that as a result of that, that my rehabilitation moved along more quickly because of my activities in my side gig. I was working out of a bedroom. We had sold our farm and moved in with a relative, and so I had limited space. But honestly, what I was doing, I could operate this eBay business from one drawer in my bureau and a towel laid on the bed or over the bathtub. And I found that I was selling two or three things per week and successfully completing the transactions. I honestly felt like I had discovered some big secret because now I was offsetting the copays with a sideline. Um, it was about that time that my wife and I started looking for our own home. We were living with her dad, and he was quite happy to have us. His wife had entered an Alzheimer's care center, and so he had been living alone in this large house for a little more than a year. We moved in, of course, brought a little bit of life and fun and social things with us. Um, we told him that we were going to look for at a house that we had found online that we were quite interested in, and his face fell when we questioned him, he said that he really enjoyed having us there and uh, we should reconsider buying a home and just stay there, which was a wonderful deal for us and actually enabled the next step because if we weren't going to buy another home, we were free to purchase something that would give me a place to operate my eBay business. And that's what we did. We bought a little church in town, very small, for I think we paid $40,000 for it. It was just a cinder block building with a dirt driveway. We put some money into it, refinished it, and redid the driveway, and ended up with a nice little shop in which I have a back room, probably 12 by 20 feet, where I now operate the eBay business. And I really feel like I have cracked the code. Let me explain what that is. Um, I go to these auctions. I go to the most expensive highline auctions that I can find, and I sit in the back and I sit all day sometimes. I went to an auction yesterday. It started at 1 o'clock in the afternoon and it goes until they have sold everything. I don't try to do the whole day, it would be quite fatiguing, but I show up about 5 o'clock and I sit in the back and I wait. And they sell all kinds of wonderful things for big numbers, but sooner or later, something comes across the auction block that doesn't get the attention or the bids that the other products do. And that's my territory. The auctioneer always starts everything high. He always says, "Who'll give me $1,000? Who'll go 750? How about 500? Let's open it up for 250. Okay. How about $100? Who wants to start it out at $100?" And everybody just sits there. The auctioneer needs to sell that. He can't move on until he unloads whatever it is. And so he just keeps dropping the price. How about 75? Let's open it up for 50. Come on, who'll go? $25. No interest at $25 for this fine antique? How about $10? And that's when Lee raises his hand up. And I buy some incredible things for $5 and $10. Last night at the auction, I I participated from 5 p.m. to 7:30, with most of my action coming around 7:15, because other people pack up. They've already spent more money than they meant to, and they still have to drive home, and the seats empty out, and the fewer people there are in the audience, the better the prices. And toward the end, I mean, it's just giveaway time. They just dump the stuff. I spent $239 last night, and I filled my car. My trunk was full, my back seat was full, and I had a lamp in the front seat with me. Unbelievable. I buy things that I know I can handle. I buy things that I know I can package, and things that interest me. Those things that I bought last night, I'll unpack and slowly photograph them, 5 or 6 things a day, and list them for sale. One of the things that I love about eBay is that I control it. It gives me worldwide views. I get millions and millions of views on my stuff 24 hours a day. Last year, I think I did $30,000 approximately, and this year I'm on track to do just under $40,000 on this sideline, this silly little thing that I started doing in order to make ends meet with the copays that I was shelling out. It's been a wonderful experience. It has been empowering, and I'm about as far from depressed as I have ever been, leading to my voicing that last spring when I walked into my office and I said, "I'm back." Something about it just felt like I had returned. Um, that, I guess, is my spiel. Uh, we have a couple of extra minutes. If anyone has any questions, you're welcome to toss them out there. Otherwise, it was wonderful sharing with you today.
Thank you so much, Lee. I think, if nothing, I gained a whole lot, especially auctioning tips, from that. But I think one of the things that stuck out to me the most, especially when you were talking about like the support groups, is the power of community and finding your community. Would you mind speaking to that for a moment? And I do see someone raise their hand. If you wouldn't mind typing in your question, that's going to be the best way for us to be able to address it.
There is nothing that will touch your heart more than sitting in a room with other survivors and listening. Um, we come from every walk of life, every age, every conceivable background is represented in any support group that you find your way to, whether it's online or in person. Um, those resources are there to support you, and it will make a world of difference if you take the first step of going there. I can't tell you the number of close friends that I now have within this community because of the support groups. It's a it is a wonderful facet of what we do.
So Lee, we have time. I'm going to combine two different questions. So someone asked first, are you still hosting those support groups? And someone else asked, within the support groups, what do you personally find most valuable? Educational sessions from therapists or more casual conversations with others?
I have handed off the facilitation of the support groups to other members. They've taken over those support groups and the role of facilitator. I still attend. Um, I think that it's an important piece of who I am. The uh, the second part of the question was about, would you refresh me?
About what you find most valuable as far as approach. Like, do you find more value in the educational sessions from like, clinical professionals or casual conversation amongst the group?
It is wonderful when a neurologist volunteers to attend, or a stroke um, coordinator from the various hospitals, a registered nurse. We certainly pepper those people with tons of questions, and it's valuable uh, beyond measure. But at the same time, it is us. It is it is the survivors that really are the support group. We provide um, information, we provide speakers, um, but there is so much need to do this talking. It's cathartic for everybody involved. And I guess I get more from the other attendees than I do from the clinical information, but they both have value.
Well, Lee, thank you so much. And with that, we're going to go ahead and actually hear from another stroke survivor, author, and advocate, Maddie Nybank. Thank you so much for joining us today, and I'll turn it over to you.
Thank you so much for having me, and thank you, Lee, for that amazing talk. I also agree wholeheartedly in like the power of support groups and community. So I'm going to talk a little bit about that in my own journey today. Awesome. So hello, everybody. Thank you so much for joining today. My name is Maddie. As Stephanie mentioned, I am a stroke survivor, an author, a content creator, and disability advocate. And today I'm going to tell you a little bit about my journey with recovery. We can go to the next slide, Laura. All right, so to get started, I want to take you guys back to the year 2002. Now, since I can't see everyone, I have no idea how old everyone is or if you were alive at that point, but if you were, I realize I'm dating myself because I was 7 in the year 2002, and you're probably like, what the heck? Why is this important that I'm sharing this? Because when I was 7 years old, specifically, I can remember the moment sitting in Miss Pruding's second grade math class, learning how to solve word problems with my classmate Peter Marchetto. I got my very first migraine. Now, maybe some of you in the brain injury community have had migraines before. If you have, one, I'm sorry. It's like the worst pain I would not wish on anyone, even my worst enemy. But if you have, then you understand. For me, this is the first time I started getting migraines, and it was like searing pain. My vision completely clouded over. I couldn't see anything. I eventually started seeing a neurologist who has prescribed me every migraine medication under the sun, most of which actually really did nothing. The only thing I could do when I got a really severe migraine was lay down in a dark and quiet room and vomit like 20 times. And it started when I was 7, but to be honest, I kept getting these migraines throughout my youth. When I was 15, I had a migraine that lasted for 24 days. Um, without stopping. And now that was like kind of intense. 24 days, I had to go to the ER. I got like all different types of medications. My neurologist, surprise, surprise, was like, this is not normal. We need to figure out what's going on. So he ordered me an MRI brain scan. The MRI revealed that I was born with a very rare condition known as an arteriovenous malformation, or an AVM for short, in the right occipital lobe of my brain. Now, an AVM, for those of you who might not know, is essentially the easiest way I can explain it is an abnormal tangle of blood vessels in the brain that don't have capillaries. So with the blood flow going direct from the arteries to the veins, it's like quite unregulated and just apparently not good. I was told that with each year of life was an increased chance of this ticking time bomb in my brain rupturing, with a 50% chance that it would rupture at some point in my life, and if it did, a 10% chance of death. So I was never good at math, but I really did not like those odds. So I started consulting with different doctors, the majority of which told me, your AVM is 7 centimeters. It is so big, it is considered inoperable, and we don't feel comfortable performing this surgery. A smaller percentage told me, your AVM is so big, this is a serious threat and it needs to be removed immediately. So, as you can imagine, like I was getting all these different contrasting opinions. I didn't really know what to do. Ultimately, after talking with my family and really thinking it through, I decided I wanted to complete my education and then go in for brain surgery to remove the risk of this thing rupturing later in my life. Next slide, please, Laura. So here's a picture of me and my family on my college graduation day. I graduated from Georgetown University in Washington, D.C., and I was so excited because I was ready to take the next step, right? I'd gotten a job all lined up. I was going to move up to Boston and launch my professional career in technology sales upon graduation. Before I could do that, though, I just had one little thing. Next slide. I had this brain surgery, right? Like I decided I was going to get this brain surgery to remove the risk, and then I should be in a good position to move up to Boston and launch my career. So here's me checking into the hospital. Unfortunately for me, though, the preoperative procedures that they did in the hospital ended up causing a blood clot in my brain, which ended up bursting, causing me to have a massive stroke in the hospital and get rushed into an emergency surgery. Next slide. My neurosurgeon had just gone home for the night. He comes rushing back. Before he performs, he's rushing me into the OR. He pulls my parents aside and he tells them the situation is grim. I lost a lot of blood. I had 7 liters of blood transfusion. The situation was not looking good for me. And he told my parents, even if she does come out of this alive, we have no guarantees of like how functional she's going to be or what she's going to be able to do. Here's some pictures of me right after that brain surgery. So he was able to successfully remove the malformation in my brain, stop the bleeding, and I was placed into a medically induced coma. When I awoke, I was completely paralyzed on the left and dominant side of my body. So as you can see, everything from my left arm and hand, my left leg, the left side of my body, I couldn't even sit up in a bed or in a wheelchair on my own. I couldn't speak or swallow. I had memory issues, aphasia, all of that fun stuff that I'm sure a lot of you are probably familiar with. So that's kind of where my rehab journey began after the stroke. So, needless to say, I was not moving up to Boston a few months after the stroke. I had bigger fish to fry, aka my rehab. Next slide, please. So, yeah, I was in the hospital in the ICU for 15 days, and then I was discharged to Kessler, which is in New Jersey, which is where my parents live in New Jersey. So I went to inpatient rehab. I did all of the rehabs, physical, occupational, speech, cognitive, at Kessler in West Orange. Next slide. You can see too also and we can play this video. Here's just a video of me learning how to walk. This is like an actual video from back in 2017. You can see like how hard it is for me. I have, as a result of the stroke, I not only I lost, I guess I should preface this by saying I lost essentially all of the left side vision out of both of my eyes. So I have no peripheral vision. On that side. And I was very desperate to be able to regain a sense of normalcy and get my life back. I was in inpatient and then I was doing outpatient living at home with my parents in New Jersey. And I just wanted to get my life back. I wanted to be able to do things independently. I didn't want to have to rely on anyone to help me. Next slide, please. So one thing I think that I would want to tell all of you here, like one of the biggest things for me, this is a video of me like a month, 2 months into my rehab, celebrating the smallest win. Look, I'm moving my arm for literally the first time. Like that was the first time I ever moved it, and my mom just so happened to like capture a video of it, which is pretty cool. But you can tell like I get so excited. And even to this day, I'm like 8.5 years out from my stroke. I get so excited just about being able to accomplish the smallest thing because I remember, and I'm sure a lot of you remember as well, what it's like to not be able to do that. And so for me, one of the biggest things has been reframing my perspective from viewing myself as like a victim. Why did this happen to me? What did I do to deserve this? To viewing every obstacle in my life as an opportunity. How can I turn this into something good for myself, for my family, for my friends, for my community? Next slide, please. All right, so when I got discharged from inpatient, that's a picture of me. I was there for like, I don't know, for like, I can't do math, like a month, basically 5 weeks. And then, I got discharged. At that point, I graduated from the wheelchair. I had a straight cane and I began my outpatient journey, but that's where the real journey began because when I was in outpatient, I remember one of my very first goals was I told my PT, Todd, great physical therapist. I told him, I have a follow-up appointment with my neurosurgeon in like 2 months. I am walking into his office without a cane. I don't care how hard it is, or like if you tell me that it's not possible, like I'm going to find a way and I'm going to do it. Because I was very motivated and very determined that I was going to reclaim my life and find a new path for myself. Next slide, please. And Todd actually, luckily for me, he understood that and he was like, "Yeah, let's do it. We will find a way." And for the record, I did walk into his office without the cane. It wasn't that good, but I mean, you got to start somewhere, right? And everything has only gotten better since then. Here is just a video. So I have a lot of things that I deal with, I guess you could say, and wrist tone is one of the biggest ones. In my arm in general, I have a lot of tone. I have to get Botox for it. But here's just a video. That's a video from one of the first times I ever like started to be able to move my wrist. And I still work on my wrist and it's getting better to this day. We can go to the next slide. So here's the slide I wanna talk a little bit about. So as was mentioned in the intro, I'm an author. I've written 2 books, and that's one of the things, if I never had a stroke, I don't think I ever would have had the courage to pursue this dream and be a writer. I remember very soon after my stroke having a conversation with one of my favorite college professors from Georgetown, and I told him, all of my friends have moved to the city, they've launched their careers. Meanwhile, I'm just in rehab going to PT and OT day in and day out. Like, my life sucks. I hate this. And he said, one of the best pieces of advice I think I've ever gotten. He told me, Maddie, why don't you take this time to kind of reframe your mindset? How can you turn this into something good? You now have this free time that you didn't have before. You can actually genuinely pursue interests of yours that you may have not had the bandwidth to explore before. And so I settled on fashion. I'd always wanted to work in the industry. However, I had never worked a retail job, let alone had any connections in the industry. So I decided this is going to be my way to start building a network in an industry I was passionate about and wanted to be in. So I started reaching out to, my own network. Does anyone know anyone I can talk to? And I'd interviewed everyone from models to fashion magazine editors to fashion executives, small business owners, gathering all of their insights about how the industry was changing and then tying those themes together and putting it into my first book. Interestingly enough, though, in my first book, I wove in anecdotes about how I was using the act of writing a book as a tool in my cognitive rehabilitation. I was going to cognitive rehab at the time, but I really hated it. And writing a book felt like a really practical and personally relevant way for me to work on those skills of how do I organize my thoughts? How do I interview someone, hold a conversation? How do I edit and write? All of these skills I needed to redevelop anyways. I was doing them in a way that was personally relevant and important to me. Next slide, please. Also, I've gone through tons of therapy, as I said. I like to mention too, one of the other things I do was constraint-induced movement therapy. So I did one of my OTs and my PTs had actually worked to like do a modified program for me, and I told them, I really want to be able to put my hair up on my own. I want to be able to use both hands. So before I could do it, I had to learn how can I lift my hand all the way up there. Is the next one a video? That's just a video of me after I went to do constraint-induced movement therapy in Birmingham, Alabama. That was what it looked like when I first learned how to put my hair up. So one thing that I do, if anyone is curious, is I use my right hand, which is my unaffected hand, mostly to gather up my hair. And then I use my affected hand kind of as a stabilizer to hold the bun on my head while I wrap the tie around with my right hand. We can go to the next slide. It's okay. I mentioned that independence was always something that was very important for me. About a little under 2 years after I had the stroke, I started my first full-time job. Now, it wasn't the job I had originally signed up for and gotten accepted to up in Boston. I was still living at my parents' house in New Jersey at the time. So I got a job for a Spanish reinsurance company called Mafre in New Jersey near where I live. And that was a great experience for me. One, trialing what it is like to work a full-time job and manage like, my fatigue and just be able to do everything. And also the point of how am I going to get to work on my own? I mentioned that I don't really have much peripheral vision at all on the left side, so I can't drive a car. This was a great reason for me to learn how to take the train, how to get in an Uber, all of these things that like I didn't really think about before, but that are important skills for me to have in order to live independently and be on my own. Next slide, please. To tie this back to what Lee was speaking about earlier with the importance of community and support, I after it was around this time in 2019 in July, I started sharing my own journey on Instagram with the intention of connecting with other survivors, sharing their stories and putting them into I was writing a second book at this time, and I was writing a book about my recovery and the lessons I learned going through that. And so I thought, what if I just connect with other survivors? There's got to be other people out there. And like support groups, like Lee was saying, this woman that you see on the screen, she is a survivor that I connected with over FaceTime back in 2019. Her name is Tawny. We hit it off. We started going Instagram live together, and we call it Survivor Sunday to share the recovery journey. And we also interview other stroke and brain injury survivors to share their stories. We started doing that in September of 2019, and we have done Survivor Sunday every Sunday since. Like it has just been an amazing way to build and connect the community and get every people's voices and stories out there. So speaking of community, like that has been an incredible thing for me and something that I've really enjoyed doing is connecting with the brain injury, stroke, disability community and getting all of our voices out there. Next slide, please. Sorry, I know I only have a few minutes left, so I'll go quick. Another important thing for me was goal setting. I had the goal to walk in heels at my friend's wedding. So I practiced a lot in physical therapy. I got a brace that allowed me to do it. And all of these, I'm very big on setting goals and then breaking them down into the steps that I think I need to pursue to achieve them. And my therapists at the time were very understanding of that too. So they were all in to help me be able to do this. And, these are also goals that I can work towards to help me when I was trying to get out to living independently and being fully on my own. We can go to the next slide. Yeah, so this is just a picture of me and some friends, and the whole point of this is to say that I did always want to live independently, and so that's something I'd worked to for the first few years of my recovery. Next slide. And you know what? Another thing that was big in my journey was I wanted to be able to travel and experience the world again. I wanted to be able to go to some amazing places and just see all that the world has to offer. So I started doing that. I remember the first time that I traveled abroad independently after the stroke was in 2019. I went to London and Dublin and those are my siblings with me. But I've gone places like there's me in Amsterdam, there's me in Vietnam earlier this year. I did a group trip for the disability community. I did a trip last year to Bali and I had like 8 brain injury survivors with me. And we had like the most amazing time just sharing our journey while also being in a cool new place and exploring all that Bali has to offer. In fact, I had such a good time. I'm doing another group trip next year to Greece. So for the community, we're going Athens and Santorini. So I'm getting super excited for that and trying to get more people to join. Next slide, please. And this is just a slide to show like always having like random little challenges and pushing myself. During the pandemic, I started a little push-up challenge. You can see I was still living at home at this time. My dad had to help me to be able to do it, but then 6 months later, I'm able to do it by myself. You can see I still have a lot of tone in my hand, but I'm able to like more or less get into the correct position to do a somewhat of a push-up by myself. So I'm all about setting like creative rehab goals for yourself and finding ways to incorporate it into your daily life. We can go to the next. Another thing I mentioned about my vision problems, I did get a bilateral strabismus surgery for my diplopia and the misalignment of my eyes. That was in 2020, and that has enabled me now. It has largely improved my quality of life because I can wear contact lenses now, which has been honestly like one of the most amazing things because I hated wearing the prism glasses. Next slide. And then in 2020, my second book, the one I mentioned about stroke recovery journey, came out. And this is just a quote you can read by one of a fellow survivor or his dad who got my book. And it's so amazing for me to get like feedback from the community that like they can relate to the journey that I'm sharing and that it's, realizing that you're not alone. That has been the biggest thing. Next slide. And we don't have to maybe just show, yeah, maybe just show that video. I love to push my limits, I said. So here's just a video, um, you know, doing fun things like being able to jump into the ocean for the first time. I will say getting back out of the ocean was getting back onto the boat was a different story, but I like to do fun activities like that, swimming, dancing, all of that. Next slide. And now, so I did work in fashion after for like 3 years after, I wrote my book and everything after I worked in reinsurance. And then most recently, about a year and some change ago, I transitioned. Now I'm the community engagement and advocacy manager for a biotech startup that helps people like me who have stroke or brain injury, who have MS and have foot drop and struggle with that. So I'm the community manager at Psionic, and our product is the neural sleeve, and you can see me wearing it there. I was actually asked to model for New York Fashion Week, and I wore my neural sleeve on the runway, which was pretty cool and a good way to get word out about, foot drop and all of that. Next slide. Just a few other things that have helped me. I actually just went today. I get osteopathic manipulation for rotated vertebrae in my neck. I've done acupuncture as well. I think all of it adds up and helps to get you better. Next slide. Oh, I already mentioned this. I worked in fashion after I wrote the book, which is pretty cool. Next slide. And then moving out onto my own for the first time was a big goal that I'd worked for with my therapist. And so that was amazing. I moved to New Jersey, my first apartment in 2021. And then in 2023, I think it was 2023. Yeah, 2023, I moved to my own apartment in New York City, which is where I live now. So that has been amazing. Get the first experience living close by to where my parents are so that they can help me if I need. And now I live in Manhattan and it's been no turning back. I love it. Next slide. I also do disability travel diaries. So I'm very passionate about sharing the experience of what it's like traveling with a physical disability. And so me and my friend in the Netherlands, we will travel and we create content around that too. So that's been like a fun way to help the disability community by sharing the journey and what it's like traveling. Next slide. My advocacy journey also began in that I love public speaking and sharing the experience of from the patient side of what it's like having a stroke. And so it kind of began, I was invited to speak at the World Health Organization in Geneva for their global rehab meeting like 2 years ago. And so that was kind of like where things really lifted off. And, I've been doing a lot of speaking since then. And it's just so important to me to be able to connect with the community. Next slide. Speaking of connecting, and we were talking with Lee just recently about the live events and support groups and whatnot. I named it after my book, Fast Forward Summits, is it? And I do live events to connect the brain injury and stroke survivor and caregiver community to connect them to each other because like Lee said, it's just so important for us to connect with people who get it, who understand what it's like. And so I do New York every year. I would actually love to invite anyone who's in the tri-state area to come to my New York City summit, which I've just set the date for as April 24th, 2026. And then I'm also doing one in Birmingham, Alabama, probably in October. So if anyone has interest in coming to those, I would love to. Like Lee said, there is just nothing quite like being able to connect with people who understand, who you don't have to explain yourself to. And like just sharing all of our journeys together with each other is so impactful. And it has honestly helped me so much in my own recovery journey, just being able to talk about it freely and openly with other people. So I'm very excited. I've been doing this now this is my second year doing them. And like I said, I'm doing them again next year. So would love to meet some of you at that. Next slide. And then lastly, this is I think one of my final slides. This is just to show that like recovery still continues, even though I'm chronic stroke at this point and very far out. I've been going to Ohio for neuroanimation therapy and like, I play games and look how much my hand is opening. It could not do that before. So much so that I was able to pinch and pick up a dice for the first time. This was back in like a month or so ago. Like so it's been quite some time since I had my stroke, but like the fact that I can still make progress is so encouraging and just shows me that there are no limits to us in our recovery journey. I don't let anybody tell me, no, you can't do this. Well, I'm also quite stubborn, but I will find a way, right? So I am very thankful to be able to continue to work hard and make progress. And you know what? You never know. There's always an opportunity. Like I said before, obstacles are opportunities, and it's my mission to find a way to turn these like traumatic events in our lives into something that is powerful for ourselves and for our communities. I think that we can go to the next one. I think that might be my last slide. Oh, these are just like some stats from my recent time playing it. Now that I'm not in Ohio, I've been doing virtual reality therapy. So that's what that one is. And like, look, I used my left hand to open a super heavy door. That was huge. Like before I'd like carry a coffee in my unaffected hand and then I'd have to like set it down to open the door. But now I can open doors without assistance, which is like crazy that something like that can happen 8 years out from the stroke. Next slide. That might be the final. Yeah, this is just my details. Like, I would love to connect with you all. Please reach out if you're interested in the summits too. But I love connecting with this brain injury community. So please contact me. There's my website as well about the summits. And thank you for having me on to share my experience.
Thank you so much, Maddie, and thank you, Lee. It is so amazing that even though y'all both walk very different paths, I still kind of go back to how community comes together, at the bottom of it for both of you, and I love how we're bringing a community together here today as well. We're going to take a very short break, just a few minutes, and then when we come back, we will hear from Brittany Cobank and Leanne about what's working in stroke rehabilitation, bridging the gap between research and real life. So we'll just take a very short little break while they get their slides up, and then we will keep going. Thank you.